Hi, my name is Dr. Mark Romeo, and today we're going to be talking about autoimmune disorders. Autoimmune disorders are one of those common things we see in our practice here that we treat with functional medicine. And the reason for that is that autoimmune disorders are very complex. They cause a whole array of symptoms throughout the body, but once they're identified, they're typically easy to treat. What we do here in the office is we'll send a patient out to the lab and get a baseline of where they're having a problem, for example, the thyroid gland. Let's say a patient comes to us with a Hashimoto's thyroiditis, which is an autoimmune condition where the body is mistaking the thyroid gland as a foreign invader. And what the body starts to do is starts to attack that thyroid gland as if it's foreign material. It's our job in the office to find a way to take the body and help redirect the immune system to be able to differentiate the difference between self and non-self. And once we have that baseline from the lab, that gives us our number that we start to work with. And periodically we send the patient out to get them retested to see if that number is changing. So for example, the thyroid gland. The thyroid gland's measurement is between 0 and 60 pg/dnl. And what that is that within that range is normal, that the body is not attacking the thyroid gland. If we start to see a number higher than 60, it tells us that the body is actively attacking the thyroid gland. I had a patient recently where we sent her out to the lab, and her reference range once again stood between 0 and 60. Her numbers came back at 290. Now that tells us that her body is actively destroying her thyroid gland on top of other tissues and treating it as a foreign invader. So what we did to calm down her immune system is we found out her foods that she was allergic to and removed those from her diet. We gave her a certain nutritional plan to help change the way her immune system sees her body and help the immune system to redifferentiate self from non-self. And then we had her make a huge modification to other areas of her life. And what we did monthly is we test her levels periodically, and what we want to see is those numbers to steadily decline and to help take that autoimmune condition that she's suffering from and to correct that. And the reason for that is that if the body continues along this path of having an autoimmune disorder, what we know with most people is that when they have one known autoimmune disorder, they have several other autoimmune disorders. So for example, a patient might have a thyroid problem where their body's attacking the thyroid gland, but they also typically will have other areas under attack, for example in their gut. And then when their gut's under attack, they can't absorb certain types of nutrients, which causes them to have certain health disorders. While the body's attacking the thyroid gland isn't making thyroid hormones properly. It's either making too little or too high. Thyroid gland hormones are too high, that can actually kill a patient. When they're too low, you start to have a patient who suffers from depression, constipation, can't sleep, they're cold all the time, they have low energy. So you can see that maintaining a balance within the body is extremely important to keep that person's health up. One of the questions in functional medicine is why did the immune system, which used to work normally, all of a sudden make a deviation, and now it starts to attack the body as if it's a foreign material, if it's an invading bacteria or virus. Something happened from being normal to abnormal to take the immune system and to confuse it. The traditional approach in medicine is to give immune suppressing drugs to try to keep the immune system from working. In functional medicine, our question is, why did the immune system go haywire, and what was that triggering event? And how do we bring the immune system back into homeostasis? How do we make it normal again? What steps do we have to do to get the body to be rebalanced, to work? Immune suppressing drugs, while they might be very valuable in the short term, you're trying to prevent the body from working. Now granted, the immune system is now working abnormally, but it's not working abnormally for no particular reason. It's working abnormally because of something that set it off. And identifying and fixing that is far more important to allow the body to do what it's supposed to do versus giving medications which may cause the individual to have other health consequences later on down the road. So once again, I'm Dr. Mark Romeo, speaking on behalf of the San Buenaventura Family Wellness Clinic, and we look forward to seeing you.